Hello. Hello.
All right. There we go.
Can you hear me?
Hold on, Claire.
Okay.
Okay, there we go.
You can hear me okay?
Yeah.
Okay, cool. Hi, how are you?
I'm good. How are you?
I'm all right. My name is Claire, as you know, student physical therapist at Governor State University. And so are we in action mode now?
Whatever.
So, okay.
I'm ready when you are.
Okay, we can go ahead. Is that a cat?
Yeah, sorry.
Oh, okay. Super cute. Okay, so you had a right total hip arthroplasty 2 days ago. How are you doing right now that we're 2 days out? Like what's like your biggest complaint, little complaints? How are you feeling?
Sure. Today I haven't been able to do my exercises today because the pain has been at its worst that it has been in the past 2 days.
Okay. What would you rate that pain?
Like 8 out of 10.
Like an 8 out of 10? Okay.
Mm-hmm.
At best, how would you rate that pain?
It's been usually at like a 5, but today it's at an 8.
Okay. And I saw that you were taking Vicodin. Does that help at all with the pain?
Yeah, it does. But today is just, I don't know, maybe trying to move it too much.
Okay. What kind of exercises are you doing?
Whatever was given to me from the physical therapist in the hospital.
Okay. Do you remember any of those?
Yeah, I've been doing them, but I haven't, I just didn't do them yet today. Like trying to straighten my leg, bend my knee up and down from a chair, those sort of things.
Okay. Okay. And when you're having pain, where is it, like at the incision site, or is it anywhere on your leg?
Yeah, the whole leg is kind of just really swollen. And
okay. Leg. Okay. All right. So just to ask some more initial questions for documentation, how do you ethnically identify?
White.
Okay. And were you employed before your surgery?
I'm retired.
You're retired?
Mm-hmm.
What did you do?
As a PT, I don't know. My brain doesn't work.
That's okay. I feel the same way sometimes. And are you under insurance?
Yeah, Medicare.
Medicare. Okay. And then do you have any allergies at all?
No.
No allergies. Cool. And do you smoke or have you smoked before?
No.
Okay. And do you drink any alcohol?
No.
Okay. And before the surgery, did you exercise at all?
Yeah, I was pretty active. Yeah.
Okay. What kind of exercise did you do?
I like to walk, golf, stuff like that.
Okay.
Golf.
How many days per week would you say that you would walk or golf?
Pretty much every day, walking and then golfing on the weekends.
Nice. Are you a pretty good golfer?
Yeah. Yes, I'm a great golfer.
Okay. I used to do Tuesday youth golf league, so
It's very nice.
pretty intense.
Made your parents a lot of money.
All right. Okay. Have you had any major life changes within the past year?
No.
No major life changes. Okay. Just besides the surgery.
Yes.
And then how would you rate your overall health?
Good.
Good. Cool. And then what would be your prior level of function like in the community? So were you said you were walked every day, so you could walk around within the community pretty well?
Yeah, up until it just was hurting too much.
Right. And it was that the reason for your surgery?
Yeah.
You just had too much pain?
Too much pain, and I couldn't walk as much as I wanted to.
Okay.
And I couldn't golf anymore because it was just too painful.
And so the major activities then that are inhibited would be the walking and the golfing.
Mm-hmm.
Are there any other like activities, even just like in the house, that you like?
Yeah, stairs was getting difficult. Walking, in the house was getting hard.
Okay. And then what would be like your major challenge right now that you're out of surgery?
Yeah, I mean, walking and the pain is pretty, limiting right now. But I want to be able to walk, from the living room to the kitchen.
Okay. Okay. And then do you live with anyone right now?
My husband.
Okay. And then describe your home. Is it 2 stories, 1 story?
2 stories.
2-story home.
Right now, I'm just staying downstairs.
Okay.
Hold on. Can you still see me?
Yes, I can.
Okay. Oops.
It's okay. Can you see me?
No. Oh, come on. Okay. I don't know what I did.
That's okay. Can you see me okay and hear me?
Oh, okay. Okay, sorry.
Are we good?
Sorry. Continue. I'm sorry.
No, you're fine. You're fine. Within your home, do you have any stairs?
Yeah, I have a 2-story house.
Okay.
I'm staying on the first floor right now.
Okay. Going upstairs, how many stairs do you have, or just maybe guesstimate?
12.
12. About 12.
Mm-hmm.
Okay. And have you tried going maybe up 1 or 2 at all, or not yet?
Just at the hospital, they had me practice.
Okay. Okay. So before your surgery, did you have to do any PT there?
I think I did PT like a handful of months ago and stuff like that, but it just was getting too, it helped for a little bit, but then it was just getting too painful, and I couldn't really do the things that I wanted to do anymore. So that's why we did the surgery.
Okay. And then you mentioned that you did a couple stairs at the hospital. Do you remember doing any other type of interventions at the hospital or type of exercises?
Yeah, the exercises that I came home with, the ones
Okay.
that
The ones that we
the-
discussed earlier?
yeah,
Okay.
yeah.
Okay. And then right now, are you experiencing any like abdominal pain, recent unexplained weight loss, pain at night? Nothing like
No.
that?
No.
Okay. And then you mentioned your pain at worst is an 8 out of 10, correct?
Yeah.
And then maybe at best a 5 out of 10?
Yeah.
Okay. And then, do you have an assisted device that you're using?
I have a walker.
Okay. And then what are your goals for physical therapy?
I just want to get back to, walking and golfing.
Awesome. And then with your scar, have you been able to check it out at all, or is it feeling okay?
Yeah, the nurse came and she checked it out and she said just to leave it until she changes the bandage tomorrow.
Okay. So do you have to go back to the hospital for that, or somebody come into the
No,
house?
when the nurse comes.
Okay, cool. Okay. So we're just gonna do a couple things here.
Sure.
Right now, we're gonna try and take some vitals. So
Sure.
first of all, have you had any issues with your blood pressure in the past?
No.
No issues? Okay. We're gonna do your heart rate. So
Sure.
I don't know if you recognize at the hospital that you can take
Yeah.
it. Or are you wearing an Apple Watch?
Yeah, I can
Does
check
it
it
tell
for
you?
you right now.
Oh, cool.
Let's see.
That's handy.
Let's see, 78.
78. Cool. Awesome. Okay. All right. So while we're just seated here, I'm going to have you go ahead and can you bring your arms all the way up
Mm-hmm.
and then all the way back down?
Yep.
And then the same thing in front of you. Good. And then behind your head like this, and then behind your back. Nice. Everything feels good with that?
Yeah.
Okay. And then I don't know if you're able to back away from your screen just so I could see like your lower extremities. Yeah. Okay. I'm going to have you, are you able to bring your knee up towards the ceiling? I guess it could help if you could see me too. 1 second.
I know what you're saying.
Okay, so go ahead and bring your left knee up toward the ceiling. Okay, and we're just going to do all of your left leg right now.
Okay.
Okay, so and then are you able to kick your leg out? That good. And then are you able to do, we call them ankle pumps, so moving your ankle up and down?
I can't see it there. Yeah.
Nice. And how about with your right ankle? Are you able to move that up and down?
Mm-hmm.
Nice. There you go. Okay. And are you able to bring your knees in toward your chair? So like tucking them under your chair?
Oh, like back?
Yeah, like that. Sorry.
Sure.
Yeah. And then how about your right leg?
Yeah.
Okay, cool. And did they discuss the precautions with you at the hospital to take with your right hip?
Something about, don't bend forward or don't cross my legs, that sort of thing.
Yep. And then don't turn your toes inward. So that makes your hip like go inward, and we want to try and avoid that as well.
Okay. Even with my incision being my incision's in the front.
Oh, I have here that it's posterior.
Okay.
Okay. Sorry.
My incision's back here.
Okay, cool.
It actually says both.
It says both for you.
Yeah, one thing says anterior, the other one says posterior. So whatever you have in front of you.
Okay, I have posterior.
Okay, that's fine.
Okay, sorry. All right.
No, not your fault.
Okay, so that was all pretty good. And then do you feel comfortable right now if you were to stand up and then use your chair as like a support in front of you?
Yeah, like push off out of the chair.
Yeah.
Yeah, that's like one of my my exercise that they gave me at the hospital.
Okay.
So you want me to get up?
Yeah. And then
Okay.
if you're able to, are you able to stand for long or no?
Yeah, I have the table I can hold on to.
Okay. And then we're just gonna go to the table and then I want to see more of movement from your legs. So you can use the table as a support.
Okay.
Once you're standing. Okay. Are you all good?
Mm-hmm.
Okay. So are you able to bring your right leg out to the side?
Mm-hmm.
With your cat on you? Okay.
Okay, it's out to, can you see?
Yeah, I can see.
Okay.
Nice. And then are you able to to bring your right leg behind you, like kick it back?
Mm-hmm.
Yeah, there you go. Good. Okay. And then so are you able to put any kind of weight through your leg right now?
Yeah, it just hurts a little bit more today.
Okay, so would you be able to do a squat at all or no?
Yeah, give me 1 second.
Okay, you're fine.
Time out. Okay. Yeah. Can you see?
Yeah, I can see. And then just do as much as you can. Did you already go? Okay. Okay.
Okay.
And then, so have you been was one of the exercises that they gave you called a sit to stand?
Mm-hmm.
Was it? Okay. Well, I have that for something we can do right now.
Okay.
So do you think you could tolerate that maybe for 30 seconds going up and down, or would that be too much?
Sure. Are you timing me or you want me to?
Yeah, I'm gonna time you.
Okay. Do I start standing or sitting?
Is it okay if you start sitting?
Sure.
Sit back down for me. Thank you. Okay, so when you're ready, go ahead
Okay.
and just do it as comfortable of a pace as you can. I'm gonna do it for 30 seconds and I'll tell you when to start and when to stop, okay?
Okay.
Okay, so go ahead and go. Okay, good job. Over halfway. And stop. Good job.
All right.
You can take a break. Cool. How are you feeling right now?
Tired.
Tired?
There's some pain in the leg.
How would you rate that pain?
Still like 8 out of 10.
8 out of 10. Okay. Is there anything that you do to make the pain better at all, like besides taking the Vicodin?
Yeah, and just like resting it.
Just resting? Okay. Okay. And then you mentioned you had a rolling walker?
Yeah.
Okay.
They gave it to me at the hospital, or
Okay.
we had to pick it up.
Okay, cool. Would you mind if we did some walking a little bit just to see how I can see how you walk right now?
Well, I don't have it with me.
Oh,
It's in the other room.
You don't have the assistant?
No, I just have the table and the chair right now.
Okay. Is there anyone at home that could get you your
I just
walker?
don't. I don't. No, not right now.
Okay, that's fine. Um, And then, so you probably don't have any stairs nearby either then?
Mm-mm.
Nope. Okay, that's fine. All right. So, right now, do you mind looking at your watch and seeing your heart rate again?
75.
75? Cool. Okay. All right. So, since we can't do some walk-in or stairs, I was just gonna go over a couple of exercises that you could do. Sounds
Okay.
like the ones that I had in mind sounds like the ones that you're probably working on right now.
Okay.
But I really think to make your legs stronger, especially your lower extremities, it looks like you got relatively good motion of them right now. I think you could probably keep working on the sit to stands. I think that
Okay.
would be a good one.
Okay.
Just to like, if you have like your phone right there and you do like what we just did for 30 seconds, and trying to improve the amount of times that you do a sit to stand, I think that would be good because that would
Okay.
help build up some strength and some endurance. So you could do that maybe once in the morning and once at night,
Okay.
doing the 30 seconds of sit to stand. And then also, I did your ankles when you went up and down. Your ankle pumps look good. Honestly, just doing that while you're sitting down during the day is good to keep your circulation going, keep the swelling down. So you could do that maybe 10 times every hour. I don't know if they
Okay.
told you that at the hospital,
Sure.
but I think that would be a good one. And then did they mention glute squeezes to you at all?
No, I don't think I've done that one yet.
Okay, so that is literally you're kind of pinching your bottom together, so you could just sit
Okay.
there and squeeze your butt cheeks together.
Okay.
You could hold that for maybe like 8 to 10 seconds,
Okay.
and you could repeat that 10 times and do that maybe 3 times a day.
Okay.
Okay, so do you want to try doing that just in case you have any questions?
I am.
You are right now?
Yes,
Okay,
yeah.
you can feel it? Okay. So hopefully that will also help strengthen your bottom because that will help strengthen your, we call them hip extensors.
Okay.
So, and that definitely helps like during walking. So
Okay.
if you strengthen that, hopefully it can make your walking easier. And I also have down here, did they mention heel slides to you at all?
No, I don't think so.
No? Okay. Well, that can also help with your range of motion at your knees, which look pretty good already, but just because I couldn't see you walking, I don't know how well that is for you. Yeah. So while you're laying down, you're literally, do you want me to demonstrate this to you? Are you a better visual learner or you want me just to describe it?
It doesn't matter. I'm okay.
Okay, I'll just describe it to you. So while you're laying down, you'll just have your knees bent and you'll literally just bring the bottom of your heels towards your butt.
Okay.
And you slide them back and forth. And again, just like the glute squeezes, you could do that 10 times, maybe 3 times a day.
Okay.
And especially maybe even like twice a day, because you could do that once you wake up in the morning. And then maybe when you go to bed, do 10 of them then as well.
Okay.
Okay, cool. And then it sounds like you know what the knee extensions are when you're sitting in your chair and you kick out your knee or you kick out your leg.
Your leg or something.
Yeah.
Okay.
But you could also do those as well, just because those are gonna strengthen your quad muscles, and those are the big guys right in front there.
Okay.
So you could also do that while you're seated, doing that 10 times, maybe 3 times a day, just like your glute squeezes as well. And then with that, after you're done doing all your exercises, making sure to stretch out your hamstrings would be important too, just so that nothing's getting too tight. So you can do that seated as well.
Okay.
Like, so with your knee extensions, when you're kicking out your leg, if you have a stool around, you could just prop your leg up on the stool and just hold that for like 10 seconds.
Okay.
And that could get a good stretch of your hamstring. All right. And those are like the big ones that I have. Do you have any questions with those?
No, I don't think so.
Was that too much? Or I know that was like a lot of what I just said.
No, I think it's okay.
You think that's okay? All right. Do you have any other questions for me? That's kind of all that I had for today.
I don't think so.
Okay.
No, I don't have any questions.
Okay, cool. Well, it was nice working with you. And
Yeah,
so just we're keep on working on those exercises, building up strength in your lower legs, well, your legs in general, so that we can get you better walking.
All right, sounds good. Thank you.
Cool. Thank you.
All right, take care.
You too.